Hello and welcome to another Froten Academy video. This video provides a comprehensive understanding about diabetes autoantibodies, their applications, how they are associated with type 1 diabetes, as well as describe the principles of the analytical methods used to measure them. Diabetes autoantibodies are a group of tests that are used in the classification of diabetes to differentiate autoimmune-mediated type 1 from other types of diabetes. This is critical due to the differences in the management approaches for different types of diabetes. These tests can also be used in the risk stratification and prediction of the onset of type 1 diabetes, particularly in the relatives of patients diagnosed with autoimmune diabetes. It's important to note that these tests are not used to diagnose type 1 diabetes, as the diagnosis is usually made through a random or fasting plasma glucose, oral glucose tolerance test, and or glycated hemoglobin A1C, along with the clinical presentations such as the diabetes-associated symptoms. Type 1 diabetes or autoimmune-mediated diabetes was previously known as juvenile or insulin-dependent diabetes, as it's commonly diagnosed in children and adolescents. However, it has now been recharacterized to reflect the immune-mediated destruction of the pancreatic beta cells. I will therefore use type 1 diabetes and autoimmune diabetes interchangeably for the purpose of this video. Before we delve deeper, let's quickly review what is an antibody and why these autoantibodies are associated with autoimmune-mediated type 1 diabetes. Antibodies, also known as immunoglobulins, are proteins that are synthesized by the activated B lymphocytes of the immune system in response to the exposure of a foreign antigen. This is a vital defense mechanism in fighting foreign antigens such as microorganisms. The body's immune system is usually very good at distinguishing between self and foreign antigens. However, this mechanism is compromised in autoimmune conditions, such as in type 1 diabetes, where the immune system produces antibodies against self-antigens present in the pancreatic beta cells. Over time, these autoantibodies interact with their complementary antigens and activate the immune system to destroy the insulin-producing pancreatic beta cells. As a result, patients with these autoantibodies lose their ability to produce sufficient insulin and thus develop type 1 diabetes, which is characterized by hyperglycemia or high blood glucose. This is because insulin plays a critical role in glucose homeostasis, and lack of insulin production therefore leads to unregulated blood glucose and subsequent fatal complications such as diabetic ketoacidosis if not managed properly. Please watch these two other videos to understand more about glucose and the role of insulin in its regulation and how these two analytes are measured in the laboratory. The links are in the description below. Now let's come back to the diabetes autoantibodies. The diabetes autoantibodies panel comprises of 5 antibodies that include islet-cell cytoplasmic antibodies, glutamic acid decarboxylase antibodies, insulin autoantibodies, insulinoma-associated 2 antibodies, and zinc transporter 8 antibodies. However, not all of these autoantibodies are routinely tested in the clinical laboratories due to their technical difficulties. For instance, the insulin autoantibody assays are highly variable and cannot distinguish whether the antibodies are produced in response to endogenous or exogenous insulin. Furthermore, the commercial assays for insulin autoantibodies are not considered accurate enough and therefore not recommended in the clinical investigation of autoimmune diabetes. As a result, most laboratories only test for insulinoma-associated 2, glutamic acid decarboxylase, and zinc transporter 8 autoantibodies for the investigation of type 1 diabetes. These autoantibodies appear months to years prior to the onset of type 1 diabetes and therefore have the potential for screening individuals at high risk. The studies have shown that the development of multiple islet autoantibodies plays a critical role in the pathogenesis and provides early markers for the progression to autoimmune diabetes. Detection of 2 or more islet autoantibodies is associated with higher risk of type 1 diabetes compared to a single autoantibody. Almost everyone who develops multiple islet autoantibodies may eventually progress to have diabetes at some point in their life. Let's now quickly review the prevalence of these autoantibodies. Studies have demonstrated the prevalence of diabetes autoantibodies to be as follows. Islet-cell cytoplasmic antibodies is approximately found in 69 to 90% of type 1 diabetics. Insulin autoantibodies is found in approximately 70% of type 1 diabetics. This is usually detected in young children, but the levels inversely correlate with age. Insulinoma-associated 2 autoantibodies is found in approximately 54 to 75% of type 1 diabetics. Zinc transporter 8 antibodies is a relatively new marker and is found in approximately 60% of type 1 diabetics. Glutamic acid decarboxylase antibodies is found in approximately 80% of type 1 diabetics. It's important to note that glutamic acid decarboxylase antibodies are not specific to diabetes and can be found in other conditions such as thyroiditis, pernicious anemia, stiff man syndrome, autoimmune encephalitis, brainstem encephalitis, autoimmune epilepsy, and autoimmune myelopathy, just to name a few. Sample requirements involves the collection of a venous blood sample in a serum tube with no anticoagulants. The sample is centrifuged to separate serum, which will then be used to detect and measure the presence of these autoantibodies. There are various analytical methods available for the detection and quantification of diabetes autoantibodies. However, these assays are highly variable and yet to be standardized. Whilst radioimmunoassay is the gold standard method to measure autoantibodies, other analytical techniques available include enzyme-linked immunosorbent assay, luciferase immunoprecipitation system, electrochemiluminescence, antibody-dependent agglutination polymerase chain reaction, chemiluminescence immunoassay, Luminex bead immunoassay, and flow cytometry microsphere immunoassay. I have a separate video on immunoassay techniques, and I encourage you to watch it for a comprehensive understanding of these methods as they have a wide range of applications. The link is in the description below. Let's now go through the principles of some of these analytical methods. Radioimmunoassay. It's a variation of the standard radioimmunoassay developed to measure antibodies and referred to as radioligand binding assay or RBA. This method uses a radio-labeled recombinant human antigens such as insulin, glutamic acid decarboxylase, insulinoma-associated protein 2, or zinc transporter 8 to incubate with the patient's serum sample. The antibodies from the patient's serum binds to their complementary radio-labeled antigens and form a complex. This is followed by the addition of goat anti-human IgG and IgM that results in the precipitation of this complex. The radioactivity is then measured and is proportional to the amount of autoantibodies present in the sample. Enzyme-linked immunosorbent assay. The indirect enzyme-linked immunosorbent assay format is used to measure diabetes autoantibodies. This method involves coating of the test wells with the recombinant human antigens of interest, which allows the autoantibodies, if present from the sample, to bind to these coated antigens and form antigen-antibody complex. This is followed by the addition of anti-human antibodies or soluble recombinant human antigens of interest labeled with an enzyme or other molecules to bind to the bound autoantibodies. A substrate is then added, which results in the production of colored products that are then measured. The color intensity is therefore proportional to the amount of autoantibodies present in the sample. As mentioned before, the detector anti-human antibodies may be conjugated with an enzyme or other molecules to generate a signal upon addition of a specific substrate in order to detect and quantify the antigen-antibody complex. However, instead of using conjugated detector anti-human antibodies, soluble recombinant human antigens of interest bound to biotin can also be used, followed by the addition of streptavidin tagged with an enzyme. In this variation, the biotin-bound soluble antigens will bind to the previously formed antigen-antibody complex, and the enzyme-tagged streptavidin will then bind to the biotin, which will produce a colored signal when a specific substrate is added that will then be measured to quantify the autoantibodies in the sample. Luciferase immunoprecipitation system. This is a newly developed diagnostic method that involves the use of recombinant human antigens of interest tagged with luciferase enzyme. The autoantibodies, if present from the sample, bind to their luciferase-tagged complementary antigens and form antigen-antibody complex. The immune complex is captured by the magnetic beads that are coated with bacterial proteins A and G that bind to the Fc regions of these autoantibodies. Upon addition of these specific substrates, the luciferase enzyme catalyzes the oxidation of the substrates and results in the production of light. This signal is detected and measured using luminometer to measure the autoantibodies present in the sample. Electrochemiluminescence. Electrochemiluminescence assays can be used in different variations, such as competitive for extremely small analytes, sandwich for larger analytes, and bridging formats to detect antibodies. The principle of the bridging electrochemiluminescence is similar to the sandwich method, except that this assay is used to detect antibodies rather than antigens. This method involves coating the plate with streptavidin, followed by the addition of biotinylated capture antigens, which will bind to the streptavidin. The autoantibodies, if present from the sample, will bind to the biotinylated capture antigens with one arm and to the sulfa-Tac conjugated detector antigens with the other arm, forming a complex. This is captured on a solid surface by the strong bonds between the biotin and streptavidin molecules. The sulfa tags are electrically excited, which results in the production of light. This is then measured and correlates to the amount of autoantibodies present in the sample. Antibody-dependent agglutination polymerase chain reaction, or PCR. It's a newly developed method that involves incubation of patient's serum sample with a pair of synthetic antigen DNA conjugates that have an oligonucleotide sequence comprising of the 5' or 3' amplicons. The autoantibodies, if present in the sample, bind to these antigen DNA conjugates and cause agglutination. New amplicons are generated when oligonucleotides and DNA ligase are added, which are then exponentially amplified with the specific primers and quantified by real-time quantitative PCR. Other analytical techniques, such as Luminex bead and flow cytometry microsphere immunoassays, are also being developed and used to quantify diabetes autoantibodies. These methods have multiplexing capabilities and can measure multiple analytes simultaneously. However, immunoassay techniques are currently the most used methods to measure diabetes autoantibodies in the clinical laboratories. The following points should be considered as caveats or limitations for testing diabetes autoantibodies. These autoantibodies were first described in individuals with diabetes who were managed with exogenous insulin preparations. As a result, we cannot distinguish between antibodies produced against endogenous or exogenous insulin. Assays lack sensitivity and precision. Type 1 diabetes cannot be prevented even if detected early. Early detection may produce anxiety. No lifestyle changes have been shown to impact the progression to type 1 diabetes. The test should not be performed in patients who have recently received radioisotopes therapeutically or diagnostically due to assay interference. And that's it for this video, and thanks for watching. As always, if you've gained any value, consider subscribing to the channel, share and like the video, and comment for constructive discussion.